Good afternoon, folks. I've got discussion aid for you off the printer. Today's topic is aging in place feels different when you tell it from the inside. That is the title of today's presentation. Now, this one, guys, is in 3 parts. Okay, so it's gonna be a little long, but has a lot of good information. Here we go. Aging in place feels different when you tell it from the inside. When you let an older adult speak in their own voice, with their own rhythms, their own quiet truths. Here, here's a first aging in place feels different when you tell it from the inside. When you let an older adult speak in their own voice, with their own memories, their own quiet fears, their own stubborn hopes. Here's a first person narrative that shows why it matters, not as a policy concept, but as a lived experience. I didn't realize how much my house had become a part of me until people started gently suggesting I might need to leave it. They meant well, they always do, but they don't see what I see when I wake up in the morning. The way the light comes through the curtains in my bedroom, soft and familiar, the same way it has for 43 years. I don't hear the creak in the hallway that tells me the furnace kicked on. I don't smell the faint trace of lavender from the drawer where I keep my sweaters. This house remembers me. The rhythm of a life I built. I know every inch of this place. I know which step on the stairs, on the staircase groans, which cupboard sticks, which window lets in a draft in January. I know how the kitchen feels at 6 a.m. when the kettle whistles and the radio murmurs the weather report. People talk about independence like it is a grand thing. But for me, it's simple. It's choosing when to eat breakfast. It's deciding whether to sit on the porch or or at the table. It's watering the plants when I feel like it, not when someone schedules. Aging in place matters because my days still belong to me. The safety of familiarity. I don't have to think about how to get from my bedroom to the bathroom. My body knows the way. My hand reaches for the light switch without searching. I move through this house like it's an extension of myself. When my memory slips, and it does more often now, this familiarity catches me. It steadies me. It keeps me from feeling lost. Aging in place matters because my home helps me remember who I am, the people woven into my days. Every Thursday, my neighbor knocks on the door with tomatoes from her garden. The mail carrier asks about my roses. The pharmacist down the street knows my name and reminds me when my refills are ready. These aren't just errands, they're relationships. They're the threads that keep me connected to the world. Aging in place matters because I'm not alone here. The memories that live in the walls. My husband painted this living room the summer before he died. My children learned to walk on this floor. The quilt on the couch is one I stitched during long winter evenings when the kids were grown and the house felt too quiet. If I left, I wouldn't just be leaving a building, I'd be leaving the story of my life. Aging in place matters because home is the last place where my memories feel safe. The truth I don't say out loud. I know I'm getting old. I know there will come a day when this house might be too much for me. I'm not naive, but I'm not there yet. And until that day comes, I want to make up in the place. I want to wake up in the place that knows me, I want to live in the rhythm I built. I want to stay where my life still feels like mine. That's why aging in place matters. Not because I'm resisting change, but because I'm holding on to meaning. Okay, here, guys, here's the second part. Let me stay in the home that remembers me. I didn't realize how much my house had become part of me until people started suggesting I might need to leave it. They meant well, but they don't see what I see each morning. The familiar light across my quilt, the creak in the hallway that tells me the furnace kicked on, the kitchen that smells like coffee even before I brew it. These smells, these small things all steady me. They remind me that my life still belongs to me. This house remembers me, and I want to stay here as long as it is safe. Aging in place isn't about resisting change. It's about it's about preserving identity, autonomy, and connection. It's about waking up in a place that knows me, but aging in place is only possible when the system around me makes it possible. Right now, they don't. If policymakers want to honor the wishes of older adults and reduce long term care costs, they must invest in the supports that keep people safe at home. What I need to stay home safely. These aren't luxuries, they are basic. They are the basic infrastructure of independence. Home modifications that are affordable and accessible. I don't need a full renovation. I need grab bars, better lighting, a ramp in front for the front step, and someone who knows how to install them. A small state grant or tax credit would keep thousands of us safe in our homes. In home support that fills the gaps, not replaces my life. A new a few hours a week for medication checks, meal prep, or or fall prevention. Visits would extend my ability to stay home by years. Insurance should cover this kind of preventative care. It's far cheaper than institutional care. Transportation options that don't require me to drive. I still get around, but not everywhere, and not always safely. A subsidized senior ride program would keep me connected to my community without risking my safety. Respite support for the people who help me. My daughter visits when she can, but she works full time. Caregivers need flexible leave and respite hours so they can help without burning out. One simple place to call when I need help. Right now, every service has its own phone number, its own forms, its own rules. I need one door to knock on, one number to call, where someone can help me figure out what I qualify for. The policy truth hiding inside my story. Most older adults want to age in place. Most can do so safely with modest support. And when we do, we delay Medicare long term care spending, reduce institutional demand, and improve quality of life. Aging in place is not just a personal preference, it is a cost effective, dignity preserving public strategy. I know I'm getting old. I know there will come a day when this house might be too much for me, but I'm not there yet. And with the right supports, the right kind of respect, my independence instead of replacing it. I could stay here safely. I could keep living a life that still feels like mine. That is all aging in place really is, the chance to stay yourself a little longer. The long term policy brief, building a system that makes aging in place safe, sustainable, and equitable. Problem statement, the gap between preference and reality. Nearly all older adults in Pennsylvania prefer to age in place, yet the current long-term care system is built around institutional care. Fragmented home-based supports and caregiver networks stretched to the breaking point. To breaking. This mismatch produces three predictable outcomes: premature institutionalization, driven by preventable safety risks at home, escalating Medicaid LTC spending as nursing home care becomes the default, caregiver burnout that destabilizes home based care and accelerates decline. The story in the introduction is not an anecdote. It is the lived reality of thousands of Pennsylvanians who whose homes remember them, but whose systems do not. Strategic version: a commonwealth where home is the first choice. A modern long-term care system must treat aging in place as the defaults, not the exception. This requires shifting from reactive to crisis-driven care to proactive preventative supports. The vision: Pennsylvania, where older adults can remain safely at home through targeted home modifications, reliable in-home services, transportation access, caregiver support, and a single navigatable entry point for aging services. Core policy recommendations. These recommendations align with the needs voiced in the first person narrative and with evidence based TLC reform, a home modification and safety infrastructure. Goal: reduce falls, hospitalizations, and premature nursing home placement. State funded home safety grants, 2,000 to 5,000 per household. Certified statewide contractor network, priority for rural counties and low income older adults. Integration with Medicaid waiver programs. Why it matters: small changes, grab bars, ramps, lighting, prevent the events that trigger institutionalization. In-home support services. Goal: extend safe aging in place by years through modest preventative care. Medicaid coverage for 2 to 6 hours a week of personal care, medication management visits, fall prevention home checkups, meal preparation and nutrition supports, expansion of home health workforce pipelines. Why it matters. Most older adults don't need 24/7 care. They need small, reliable supports. Senior transportation access. Goal: maintain independence and reduce unsafe driving. Subsidized senior ride program. Partnership with transit authorities and ride share providers. Rural mobility pilots. Medical appointment transportation guarantees. Why this matters. Transportation is the hinge between independence and isolation. Caregiver respite and workforce stabilization. Goal: prevent burnout and strengthen home-based care networks. Paid family caregiver stipends. Flexible caregiver leave policies. State-funded respite hours. Training and certification pathways for family caregivers. Why it matters. Caregivers are the backbone of aging in place, and they are exhausted. One door access to aging as services. Goal: eliminate fragmentation and increase uptake of available supports. Statewide aging and PA portal. Single phone number for all aging services. Integrated eligibility screening. Navigation supports for families and caregivers. Why it matters. Older adults shouldn't need social workers to find basic help. Fiscal impact and cost avoidance. Aging in place is not only humane, it is fiscally responsible. Key cost drivers. Nursing home care averages $120,000 a year per resident. Home-based supports average $12,000 to $20,000 a year. Falls cost Pennsylvania more than $1 billion per year in hospitalizations. Caregiver burnout, drivers, avoidable Medicaid LTC enrollment. Delaying nursing home placement by even 6 to 12 months yields substantial Medicaid savings. Home modifications reduce fall related hospitalizations by 20 to 50%. Transportation access reduces emergency department visits. Respite support stabilizes caregiver networks and delays institutionalization. Aging in place is a cost avoidance strategy, not a cost center. Equity considerations. Aging in place is not equally accessible across Pennsylvania. Barriers, rural counties with limited home health workforce, low income, older adults living in aging housing stock, transportation deserts, caregiver shortages, digital access gaps, equity actions, rural workforce incentives, targeted home modification grants, transportation pilots in underserved counties. Culturally compliant caregiver training, digital navigation, support for older adults. Equity must be embedded, not appended. Implementation roadmap, a phased approach, ensure feasibility and measurable impact. Launch statewide home modification program. Establish one-door access portal. Begin caregiver respite expansion. Okay, guys, that is A for you. I will be back on with B shortly. Give me a bit for that, please.